Only about half of individuals who are eligible for VA care are actually seeking VA care. And there's a number of different reasons for that, but that means that the rest of individuals who served in Iraq and Afghanistan and are seeking care in the community. And what that requires is community providers to be savvy about a number of things. I think about military and military history and military culture as a diversity issue, right? So you would need to get up to speed about military and military-related culture. Just like any other diversity issue, if you kind of came in and didn't know, or were only counting on your client to be the educator of that, that wouldn't be appropriate. So people really need to be able to make sure that they have some background. And there's many different training resources online. The other thing they need to think about are kind of specific maybe conditions that are frequent amongst those who have served, stress-related conditions, whether that's psychological or physiological. It may be brain injury, TBI-related, it may be post-traumatic stress-related, but feeling fairly comfortable with those conditions. And what I would say is that oftentimes mental health providers don't feel like brain injury is in their purview, and actually it is. We don't have enough providers who know about TBI, traumatic brain injury, and related sequelae to not have that be in the purview of mental health providers. Many of the symptoms are mental health related. Mental health providers actually have the skills necessary. So one thing I would say is if someone comes in and says they think that they're having symptoms related to a history of TBI, start to talk to them about what those are, and likely many of those symptoms will be things that you as a mental health provider already know how to help with. Things like depression, things like sleep problems, things like chronic pain. Certainly you'd want to have a team involved and make sure there's nothing acute going on. But these are things that we can't say this is somebody else's purview. This is all of our purview, and the main thing is that we need to work together